welcome to the pharmacy virtual learning experience. Before we get started, I am going to share this disclaimer that you're about to see on your screen and just kind of read over this before we get things going. So the PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an educational program for patients. Any clinic-specific information shared by the nurses is the opinion of the nurse and not intended to replace the recommendation or request of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. Again, everyone, welcome to the PharmAssist virtual learning experience, an educational program created by Mandel's Clinical Pharmacy to bring you together with outstanding healthcare professionals right from the comfort of your own home. PharmAssist takes place every Monday at 7 p.m. Eastern Standard Time. Tonight, we'll be providing live medication instructional program on 3 fertility products. They are the Gonal-F multi-vial, Ovidrel, and progesterone and oil, including interactive question and answers throughout the program. Please join us via Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format. We are joined by various amazing healthcare professionals each week from across the nation to provide you with real-world experience, just as if you were sitting across the table from them in your clinic. Today, we are joined by Karen Hammond. And again, thank you again for your interest this evening. And now I'm going to turn it over to Karen.
Hello, everyone. Thanks for joining us tonight for this PharmAssist program. My name is Karen Hammond. I am a doctor of nursing practice in Birmingham, Alabama, and the director of infertility and assisted reproduction at Innovative Fertility Specialists here in Birmingham. I'm really excited that y'all are here with us tonight, and I look forward to sharing some information about these 3 medications that Morgan has mentioned. Now, the way this program works, if you're new to PharmAssist, is I'll talk with you about 3 different medications. Each one, I'll tell you some details, and then we'll go through a pre-recorded video that shows you exactly how to administer the medication. Then we'll open it up for Q&A. It's fine just to type in your questions in the chat if you like during the conversation, or if you prefer to wait till the end, that's perfectly fine too. We are here for you. Our program is meant to be an adjunct to what your healthcare professionals have already shared with you. And we just want to answer any questions and clarify anything that you may have concerns about, just to make sure you are absolutely comfortable with administering the medications that have been provided to you. We're able to give some general information, talk about the specifics of how to do the injections. But if you have specific questions, your healthcare provider is going to be the best place to go. So let's start out by talking about the first medication. It's one of my favorite ways to prescribe gonadotropins, and that's the Gonal-F multidose. This medication does require just a little bit of mixing or reconstitution, but there's a little bonus because there is an overfill in this medication. I generally write for the 450 IU multi-dose vial, but the secret is there's actually 600 units in there, sometimes even a little bit more. So you can save some money. Your healthcare provider will help figure out exactly what you can do to take advantage of that overfill and make sure that you feel comfortable using it. So this medication, again, it requires just a little bit of mixing, but it is easy to do. It goes in your belly or anywhere in the fatty tissue, and you just have to be able to pinch an inch to give the injection. Very easy, very short needle, and pretty painless injection. So Morgan, if you'll go ahead and cue up that video, we'll show you exactly how to administer it. I'd like to talk with you about how to administer Gonal-F using the RedEject pen. If your prescriber has prescribed the RedEject pen for you, it's very simple to give yourself the injection. When you take the pen out of the packaging, you simply remove the cap, and you'll see a dosing window on the side that tells exactly how much medication is actually in the pen. Next step in preparation is to take one of the needles And it comes in a little package where you just pull off a tab, and then the needle will screw directly on to the tip of the pen device. Next, you'll dial your dosage. And for today's purposes, we'll say the dose is 150 units. And you just dial that. You see it in the window. No worries if you go beyond it. You can just dial the pen back the other direction. Then take the top off of the needle. There's a big cap first. And then secondly, there's a tiny cap to cover just that tiny little needle. And to administer this, you give it subcutaneously. That means in the fat, generally in the abdomen or the outer part of the thigh. To do this, just choose your site first. If you want to give it in your abdomen, you should go someplace around your belly button, like where these little blue areas are, or either in the outer part of the thigh, anywhere really that you can pinch an inch. Then you pinch up the area because you want to make sure it's going into fat. You bunch it up a little bit, put the needle straight in all the way, and then depress the plunger. You'll feel it vibrate just a little bit as the medicine goes in. Then release the plunger, wait a couple seconds, and pull the needle straight out. And just like that, you've given the injection. After you've administered it, you want to carefully remove the cap remove the needle by putting the outer cap back on and untwisting it. Then you can dispose of it into a sharps container or protected device. Just drop it in there. If you look in the window after you're done, it'll tell how much medication you have left. And these pens are somewhat overfilled. So just because you've used what you think the total dosage is, take a look in that dosage window because you may have some extra that you can use. Then recap it and you can place it back on the counter until you're ready for your next injection.
But I guess one of the first questions that came up was, kind of mentioned it, but the difference between a multi-use vial and the pen. I think you talked about the overfill. We can talk about that. If there's a preference for providers, which one's better? If a patient should request one over the other, or what's your thoughts on those?
Perfect. Great question, Morgan. And my thoughts about that, well, I know it's the same exact medicine. No matter how you're administering it, it is Gonal-f. It's FSH. That's the hormone that is used to stimulate your ovaries to grow and mature eggs. How you take it, how it's prescribed, what format, is really, all things are equal. It's just a matter of your provider's preference and your own preference. And I am willing to bet that your provider will listen exactly to you and hear out what you think is best and what you feel most comfortable with as well. The reason I like to write for this is the syringes are so cool. They have, instead of cc's or milliliters or something like that written on there, it tells exactly how much of the Gonal-f you're pulling back. So I use the example as 150 because that's probably the average amount that patients take. It can go way up or down either way, depending on each individual patient. But once you put that liquid in there, when you draw it up to what your dosage is, 150 units. You don't have to try to calculate how many cc's is how many units. It's already done that way for you on these special syringes that come with it. I generally write for the 450 IU multi-dose vial. And with that one, you just put in the liquid, you draw back 150 units if that's your dosage or whatever your dosage is. And for that, even though it looks like you're not going to have enough, but for 3 injections, patients can actually get 4 out of it. It is overfilled that much. So you might be wondering, why in the world would they be overfilled like this? And part of it is because every time you draw out medicine, you use a little bit of, lose a little drop or two, just coming from the rubber stopper, or maybe when you pull the needle out of the vial, you might notice that a little bit of fluid comes back out. And that's completely normal. Just like it is with the pens, you may notice a little drop. It's good to notice a little drop actually at the tip of the needle. And those drops add up. So if your dosage is really, really low, if it's like 37.5 units, for example, you're going to lose more of those drops. So the FDA has required that there be at least 450 in this 450 gone left multi-dose. There be at least 450 units in that is deliverable. So there's a little bit that's overfilled. And I tell everybody, including myself, to take advantage of that extra medication. Again, it's the same thing, the same medicine as the gone left pen. Um, it's just delivered just a little bit differently.
No, I agree. And also what that's super handy is if you have to give your shots intermuscular, for some patients, they have to do that. The multi-use vials are so much easier because you said that the syringes are just measured exactly. So it's super helpful with the multi-use vial, and the overfill is always an added bonus too.
Yes,
So then the question
absolutely.
is, what does like gonal F mimic in a woman's natural cycle? Like, why is a patient or why is a provider prescribing this medication for our fertility patients?
Great question. And I think it's important for you to know why you're taking a medicine and actually how it works. So when we are growing eggs and maturing eggs in our ovaries, our body naturally produces FSH, follicle stimulating hormone. It's one of the few hormones that our body produces that actually does what it says it's going to do. It's aptly named because it stimulates the follicles or the egg sacs to grow. When this is done in a spontaneous cycle, your body sees that the levels of estrogen are really low, and then that will encourage your brain to make more FSH, and that works right on your ovaries. So it's because your estrogen is low that your brain will make more and more FSH until it gets to that magic point that you approach ovulation. Now, the reason that we would give it, even in women who ovulate normally, is because it pushes your ovaries a little bit harder. This is especially important, not only if you don't ovulate, but if you are going to be doing IVF, or if you're taking these medications to stimulate multiple eggs in conjunction with an insemination, depending on what your particular fertility issue is, this is going to push your ovaries to work a little bit harder. So hopefully you're going to have more than just a single egg that is produced and ovulated. So the follicle stimulating hormone that's in gonal F as well as in follistim actually stimulates your follicles to grow and develop and mature. And as the follicle grows and develops and mature, the egg inside that each follicle will also do the same. We can get an idea about how mature the egg inside the follicle is by measuring the size of the follicles. And in lots of cases, we'll measure the estrogen levels, the hormone that's produced by the developing follicle. We can measure that with a simple blood test.
Perfect. And then with that, what are like the most common side effects that patients can expect? And then what are side effects that if they're experiencing, they should probably call their provider or their nurse and talk about?
Great question. It's always important to know kind of what to expect when you're taking any of these medications.
Exactly.
And really, there aren't really side effects to each injection. They're not a painful injection. It's very uncommon to even have local reaction, little redness or irritation where the injection is. That's really uncommon. If you do have any of those things, certainly let your healthcare provider, your nurse know. But the time that you might notice some normal reactions to taking this medication, keep in mind it's stimulating your follicles to grow. And in a normal cycle, it's just one that gets to be mature. But when you take this medicine, we often want there to be more than just a single follicle that gets to be mature. So in that case, you may feel your ovaries getting bigger. So you can have where it feels like you can feel your ovaries when you take a step. It feels like something's jiggling in there. It can just be from a weird sensation to discomfort, or in some cases even pain if your ovaries get to be really big. You may notice some abdominal swelling or bloating. You may notice that intercourse is a little bit more painful. But if you think of it as your ovaries being bigger, those are the kind of symptoms that you're going to have, just that bloating, and most of the time it's just discomfort. Now, the time that people are most likely to see a complication from the medication is going to be after ovulation, because that leftover sac that the egg was in, once the egg is released, either because of an HCG injection or because of an egg retrieval, that leftover sac refills with blood and some other fluids and becomes a functioning gland to make progesterone. That's another medicine we'll talk about in a little bit. But when that corpus luteum forms, that's the what the gland is called from the leftover egg sac. When that forms, it actually gets a little bit bigger than the follicle was, and it can get a lot bigger than the follicle was. That's when your provider's already probably talked to you about ovarian hyperstimulation. That's where you might start to worry about that a little bit. Your provider will talk to you in great detail about when he or she wants themselves or their nurses to be called. Anytime, I think it's always better to err on the side of caution. Ovarian hyperstimulation to some degree is kind of intended to have some mild ovarian enlargement. But if it gets to be where it's really uncomfortable, if Tylenol doesn't help, if you have nausea or vomiting, or anytime you're concerned, you should reach out. And certainly if you gain more than about 5 pounds. Again, those symptoms like that associated with ovarian hyperstimulation are going to be more likely to occur after you've ovulated. So it'll be after you have taken HCG, you've had your insemination or your timed intercourse, or you've had your egg retrieval. While you're taking the medicines, I think the most common symptoms that you're going to have are just feeling that a heightened awareness of your ovaries, feeling or knowing that they're big.
Yeah, I always tell my patients that their ovaries are going to feel like they're going from like an egg to a grapefruit, just feeling that extra bloating and pressure. I think you made a great point. If any, I always tell patients any symptoms, signs or symptoms, whether they think is big or small, to always like run it by their nurse or their doctor. It can't be too safe.
Absolutely. Absolutely.
Okay, I think that's all the questions. Do you have any more comments or anything like that on the Gonal-F multi-dose vial?
I really don't. It's an easy medication to prepare. It's an easy medication to administer. You want to make sure that you're taking the dosage that's been prescribed to you. I recommend to patients when they get their box of medications, they open everything up and take a look at every single thing that's in there. The folks at Mendel's do a great job of labeling what goes with what, so there's no confusion. But with this particular medicine, with the Gonal-F multidose, everything comes in one little box. So you've got everything that you need right off the bat in that one little box that's aptly labeled Gonal-F multidose. Nevertheless, you want to open up your box, take everything out, and make sure you feel comfortable with it before the time for that first injection. Any other questions come through?
I don't think so. Not that I can tell. So I will get us going for the next medication.
Okay, perfect. Well, the next medication that I'm going to talk to you about, I tried to talk to you about it earlier already, but that is Ovidrel. Ovidrel is HCG. It's made in the laboratory and manufactured commercially. And the way this medication works is it mimics your own LH surge. Remember a few minutes I talked to you about how your follicles get bigger and bigger in response to the FSH until they get to a certain point. Well, that certain point is when your brain recognizes the estrogen is high enough, and it will push your body to have a huge release of LH. And that induces the event of ovulation. Well, HCG mimics that and is much easier to give, and it's commercially available. This medication, also very easy to prepare and to inject. But the important thing about this medicine is taking it at the very specific time that you're instructed to. We'll talk about that a little bit more on the other side of the video. I'd like to talk to you about administering Ovidrel. If your prescriber has recommended you take Ovidrel, chances are you were told to take it at a very specific time. Good news, it's very easy to give this injection. The Ovidrel comes in a little package like this, and you simply open it up and remove the inside part. like that. Fortunately, with this medicine, it's in a pre-filled syringe. So the medication is already drawn up, mixed, and ready to administer. You just pull the plastic tab off and then choose the site that you want to give the injection. Since this is a subcutaneous injection, that means it goes into the fat. Most people recommend that you take it beneath the belly button, out to the side an inch or two and down an inch or two, or either in the outer thigh. Once you select the site to give the injection, you can use an alcohol prep just to gently wipe the area. So you bunch up the tissue, wipe the area once with an alcohol prep, remove the top from the syringe, and then put the needle straight in, all the way, depress the plunger, release the tissue, release the plunger, pull the needle straight out. Afterwards, you should put the needle and syringe in its entirety directly into a sharps container to avoid getting stuck with it. Congratulations, you've now given your first injection of your Avidrel. You almost feel like you're cheating when you take this medication because it's so easy to do. It's already fixed up. The hardest part about this is opening up that package. You saw it made a lot of noise and trying to find the end of it to pull it off. Opening up the package and taking the cap off the needle. Those are the hard things. And you're already going to be a pro if you've taken Gonalef or one of the other fertility injections. You're already going to be a pro at putting the needle in. This medication does not hurt. It's very easy. And it's almost foolproof.
Yeah, I totally agree. It's one of the easier ones compared to everything else that patients have to go through. So you kind of briefly touched base on it, but the timing, why it's so important. What do you do if it's like a couple minutes late compared to like 30 minutes late? What should a patient do in those circumstances?
Excellent question. So this medication is going to be told, you're going to be told to take this at a very specific time. The reason is we're going to know about when your eggs are mature based on when you've taken this. If you take it too late, then the eggs may not be quite mature enough. And if you take it too early, then you may ovulate too early. And that's definitely not a good thing, especially if you're going to be having in vitro fertilization. You don't want the eggs released before we're going in there to do the egg retrieval. So we'll give you a very specific time to take it, like take it tonight at 9:30. And I tell my patients to set some alarms. If unfortunately, sometimes we tell people to take it at 1:30 in the morning at some bizarre times. So I tell patients to set their alarm on their alarm clock, to set their telephone to wake them up, tell Siri to wake you up, whatever it takes. I generally don't have a problem with people remembering to do it right on time because that gets close to the moment that you've been waiting for to really move forward with the process. But it is important you take it right on time. Now, I don't want people to obsess over this too much. If I say to take it at 1:30 in the morning and it takes you a couple extra minutes to do it, and here it is 1:34 and you're just now taking it, I don't think you need to call anybody or worry about that. It's forgiving within 30 minutes, probably on either side. If it's much more than that, certainly if it's more than an hour, I would recommend that you call your provider, let them know that's an acceptable call in the middle of the night. If you're way off, if your alarm didn't go off, your power was out, your phone was out of juice, and you missed all of those backup ways to remind you to take your injection, I would recommend that you call your provider instead of just jumping in and taking it right then, because your procedure timing is based on the HCG. Those things have to be going hand in hand. So it may be that your provider tells you to take it at a different time or to take it right then. Your instructions may change. Nevertheless, do everything you can to take it right on time. But if there is a discrepancy, a disparity, and when you can take it based on the time you were given, I think that warrants a call to your provider. I'll tell you that I have had patients who slept through their alarm and didn't end up taking their medication, and they would call and say, oh my God, what do? I totally missed my window. And so I always do my best to try to reschedule the time of their procedure. The time that is the hardest is if they take it too early. For example, I had a patient about a year or so ago who I told to take her HCG at 1 o'clock in the morning, and she took it 24 hours too early. So instead of doing it at 1 o'clock the next day, she did it at 1 o'clock, the very next 1 o'clock. She took it 24 hours too early. And when she came in, she had already ovulated. Had she let me know that, we might could have tried to retime things. Your provider really does have your back. I always tell patients, I write it down, I have them repeat it. It may seem like I'm being pretty Mickey Mouse about it, but we want everything to go to perfectly for you. So my advice to you, after you're given those instructions, just reiterate it back to whoever is telling you and say, so you want me to take it tonight at 9:30 or tomorrow night at 9:30. And I tell people it's kind of redundant, but I'll say 9:30 p.m. tomorrow night. So I'm that specific. And my guess is your provider or your nurse, your contact at the practice is going to be very specific and redundant too. So that is the right thing to do, and we want to make sure that you are perfectly comfortable with that, and that you have everything done just like you need to do.
No, I agree. I tell my patients to set 2 alarms, especially when those weird times at like 2 a.m. or 3 a.m. And then same thing, we always have our patients repeat back to us the instructions to make sure what I think I said, that's exactly what they heard, because it is such an important medication. So I totally get all that. What are some side effects that a patient might experience with Avidril or should maybe expect? What are like the major side effects from taking this medication?
Great question. Always good to know about side effects. So if honestly, there really aren't any side effects to taking this. You're not going to notice any discomfort in all likelihood with the injection. It's pretty easy. Most people don't have any local reactions, but this goes hand in hand with ovulation. So especially if you were taking medicines to stimulate your ovaries and you're going to release more than a single egg, then your ovaries are going to be bigger. You're going to make more of those corpus luteal cysts like we talked about. So the thing that you really want to be aware of when you take HCG is that you may have some symptoms of hyperstimulation. Most people are either going to have an egg retrieval and they're going to feel like their ovaries are big, or they're going to have an insemination or timed intercourse, and you may feel tenderness or menstrual-like cramps, bloating right around the time that you're about to ovulate. Usually feels a little better right after you ovulate because your ovary collapses in size for a little bit. But then the ovary, the corpus luteal cysts re-expand and the ovaries get to be bigger. So you may notice a little bit more discomfort at that point. Again, if you have nausea, vomiting, pain that doesn't get better with Tylenol, if you gain more than about 5 pounds, or if you have concerns, if you just say, this doesn't feel right, always err on the side of calling your provider or your nurse. We never mind hearing from you about any questions that you have, and would much rather you call us not thinking something is nothing when it really is something. So we're always here for you and want to make sure that this is really easy for you. The injection itself is easy, it's quick, and you won't have direct side effects from the injection itself. It's just from the event of your eggs getting to be mature and releasing either by ovulation or retrieval.
Perfect. Okay, thanks for all the questions I see so far that's come in. Anything else you want to add before we roll on to the next video?
Thank you. The only thing that I'd want to add is that your provider may have recommended that you take Avidril or HCG. Those medicines work exactly the same. One is human derived, and the other is laboratory manufactured. So they work just the same. There's just a little bit difference in the way that you mix them, and you may notice a little bit of a difference if you give the human-derived injection of the HCG. You may notice a little redness or irritation at the injection site. You may also be prescribed to take more than a single dose of Avidrel. You may be told to take 2 of them at one time, or you may be told to take 1 of them. So take heed to the advice of your provider and the professionals that you're seeing at your practice. They'll tell you exactly what to do. Make sure you're comfortable with it, and make sure that you ask any questions of them that you have as well.
Perfect. Okay, that was, yeah, such a good feedback on the different types of HCG or HGH that they could be taking. I'm sorry, gosh, HCG. Wow, all the H's. The difference between like Avidrel or something else. Okay, you ready to roll into the next video? Progesterone oil, I think, is the last one up.
Okay, perfect. Let me, I'll tell you a little bit about the progesterone oil. This is the injection. When I talk to patients, this is the one they're most nervous about doing because they've heard people say bad things about it. But I will promise to you that if you pay close attention to this video, you ask all the questions you have, you put the needle straight in all the way, this is going to be just as easy as the other injections. So we're going to go ahead and start that video, and then we'll talk about some questions and other comments on the other side. Your healthcare provider has recommended that you take progesterone and oil for injection. There are a couple of ways this can be prescribed for you. One is in progesterone and oil that could be sesame oil or peanut oil. The other is progesterone and ethyl oleate. Your provider will tell you exactly which one you need. To administer this medication, you must give it intramuscularly. It's important it go deep into the muscle of your hip to make sure that it doesn't leak out into fatty tissue. You've probably heard some horror stories about people taking progesterone and oil, and they say they have redness and irritation and lumps and bumps. But I promise you, if you take it where you put it deep in the muscle, you're not going to have any problems at all, and it will be very easy. This is a diagram of where you should give it in the muscle of your hip. It's actually in the upper outer quadrant of your hip, as you can see the green area in this diagram. I tell patients to simply put their hands on their hip bone, relax their palm back, and give it in that muscle. It's called the ventrogluteal muscle, and that's the best place to give it to make sure that it can go deep into the muscle. To give the injection, it's really very easy. It's already mixed up. You start by taking the top off the vial of the medication. The first time you give it, there's no need in wiping it with alcohol, but with your second injection, you want to wipe it with alcohol just before you draw it up. Next, you'll need the syringe that has a needle hooked on it. And you can either use the needle that already comes with a package. It's probably going to be gray to draw it up and to administer it. Or you can change the needle and put on a bigger needle to draw it up. That just makes it easier. It is an oil, so it's going to be a little bit more effort to draw this medicine up than perhaps some of the other medicines you've taken. To put the new needle on, just screw it right on the tip of the syringe. Then remove the needle top, expose the needle. You won't mess it up. The one that looks like a nail is not the one you're going to give it with. And just take the tip of the needle and put it right into the rubber part of the top of the vial. Turn it upside down, making sure you see the needle in the liquid. That way you're not just going to withdraw air. Your prescriber will tell you exactly what your dosage is. The average dosage is about 50 milligrams, so we're going to draw that up today, and that's going to be 1 cc. And you just pull back to the amount that you've been prescribed to take. And I like to pull back right on the line and then withdraw the needle from the vial and then put just a little bit of air in there. When you do that, when you give the injection, It seals it with the air and makes sure you get all of the medication in and none of it's wasted. If you change to put a bigger needle on to withdraw it, just recap it and discard that needle in your sharps container. Put on the smaller one to administer the medication. Only on soap operas is it instant death if you get a little bit of air in there. So if you see a little air bubble in there, it's no problem at all. It's just that little bit of air, just to one line or two to give the air, just to seal it into the muscle. Then choose the location on your hip that you want to give the injection. Take an alcohol pad and wipe the area where you're going to administer it. Just one time. We know you're already clean. Just wipe it one time. Separate the tissue. Remove the top from the needle. Put the needle straight in all the way. Again, you want to make sure it's going all the way into the muscle, so it's important you put the needle all the way in. Withdraw just a little bit, and you'll probably get a little bit more air. If you get a little bit of blood, just pull the needle back just a tiny bit and go ahead and push the medication in. Again, this medicine is in oil, so it takes a little bit longer to push it in. But once all of it is in, just release the skin, release the plunger, and pull straight out. If you have a little bit of fluid or a little bit of blood come out, there's no cause for alarm. Just take the alcohol pad and apply a little bit of pressure, or just wipe the area off and apply a bandage if necessary. After you give the injection, you can put the needle and syringe directly into a sharps container for safe disposal. And just like that, you've given your injection of progesterone and oil. So hopefully that wasn't too intimidating, and maybe it made you feel a little bit more comfortable. This injection is feared by so many people, probably because they've read things on some of the online groups or Facebook or whatever, and people tend to share bad stories about it. But I promise you, if you just make sure that you put the needle straight in all the way when you give the medication, it's only when it leaks out into fat that it's going to cause some redness and irritation. So I think you're going to do great with this medication. Morgan, what questions do we have for this?
Yeah, so the first one is after you give your first injection of progesterone oil, how should they store it? Can it be left out? Do they put it in the fridge, or what do you suggest?
Great question. It is important that this medicine be left out. You do not need to put it in the refrigerator, just like you would want to put most oils in the refrigerator because they're going to get thicker and going to be harder for you to draw up and administer, and that in turn might make it a little bit more uncomfortable. So I tell patients to put it in a safe place wherever they're going to do their injections. Most of my patients do their injections in their bedroom or bathroom, so you just want to keep it away from children or your pets. But don't just keep it at room temperature. You don't have to put this in the refrigerator. In fact, I would say don't put this in the refrigerator. After you do that first injection, you're going to know that you're a pro and not have any problems with it at all.
Exactly. With that same being said, once you open a vial, like let's say use it for the first time, how good is that vial? How long does it last for? Like how long can a patient be using that? Or if let's say they use a vial in an old cycle, is it still good with this cycle if it's been a couple months later?
Great question there too. So anytime you open a medicine and you're going into the vial more than one time, you shouldn't keep it for more than 30 days. If you look on the bottle of medicine, if it says it's for multiple doses or multiple uses, you know that once you open that top and you give medicine out of there, take medicine out of there for the first time, you should use it within 30 days. Now, since the average dosage of this is 50 milligrams, that's 1 cc. It's a 10 cc vial, so it should last you about 10 days. The question is going to be, if you're taking it for 2 weeks and God forbid you're not pregnant, can you use this in a later cycle? Most people don't do 2 cycles back to back, so it's generally not possible. The good news is this is one of the less expensive medicines. And in my state anyway, it's one of the medications that insurance does help cover. So maybe the cost isn't going to be such a big issue with this. But once you are pregnant, you may be instructed to take this medication for a few weeks. So it's not commonly a concern to have a lot of this medications left over.
Beautiful. And what is, if a patient, why are they on this medication? Why would a provider want to prescribe progesterone oil for a patient in their cycle before their transfer or after transfer for an IUI cycle?
Great question. So I love talking about the physiology and why people are prescribed medications that they are. Remember, I talked about with the other medications, when you take the FSH like Gonalef or Follistim that stimulates your follicles to grow, the HCG or Avidrel will mature your eggs and prepare for the release or for the retrieval. And then after the eggs are released, either on their own or by an egg retrieval, the leftover sac that the eggs are in makes that corpus luteal cyst. Any gland, the definition of a gland is a structure that makes a hormone. So the hormone that this gland makes, the corpus luteum, is progesterone. And progesterone helps stabilize the lining of your uterus. The FSH, as it stimulates the follicles to grow, increases the estrogen levels, and that builds the lining of the uterus, while the progesterone stabilizes the lining of the uterus to help you hold on, maintain a pregnancy. If you're having IVF, then the corpus luteum may not be quite as good as if you're ovulating on your own, because not only will you take that egg out of the follicle, we're also taking out all the fluid that's in the follicle, and that may impair the ability for the egg to, the sac to make a normal corpus luteum. Also, if you have taken certain medications like Lupron, leuprolide acetate, that can impact your ability to make a normal corpus luteum and have good progesterone levels. So the reason progesterone is prescribed is to keep that lining of your uterus stable. So hopefully you can maintain a pregnancy, and it'll all be worth it in the end.
As I tell my patients, every shot hopefully will be worth it in the end.
That's right. One step closer.
Exactly. Looks like one of the patients wrote in that she's scared and she's kind of worried about doing a pressure oil injection because of the location of where it's at. Is it okay, or do you recommend having a partner or spouse, family member, friend doing it? Or do you really think it's okay for the patients to do it themselves?
That's all a matter of personal preference. And I think that's a good question to ask. If it were me, I'd much rather somebody give it to me than me give it to myself. It's a little bit awkward to reach back to give it into your hip, although probably 20% of my patients do their injections on their own. Have some patients who are very different from me and say, somebody's going to put that needle in me, I'm going to put it myself. And they feel strongly they want to do it themselves. It really doesn't matter who does it, as long as you can get the needle all the way in, as long as you feel comfortable that either you or your partner or your friend or family member is able to put that needle all the way into the muscle. I have some patients who have taught older children how to do it. They'll bring somebody in with them. I'm happy to teach anybody how to do it, and I'm sure your provider and your nurses are too. You can give it in the outer part of your leg, but I think this medication, it's important that it go into a big muscle because it is an oil and it does have to be released and dispersed into the muscle. So for that reason, I personally don't recommend that you take it in the back of your arm, like you probably got your COVID vaccine or your flu shot. I recommend instead that you take it in a big muscle. Primarily, I recommend you take it in the back part of your hip. If you really can't stand the thought of doing that, the outer part of your thigh. But I really think the back part of your hip is the best place. And make sure that if you just put your hands on your hip bone, it's actually your iliac crest, and rest your palm back, it goes under your palm. So it's really the upper outer quadrant of your hip. A lot of times people give it too low. And if you give it too low, that's where God made us women to have more fat deposits. and it's more likely to be in fat if you do it like that. I generally mark with a Sharpie on women's hip exactly where to give or receive that injection. And oftentimes they tell me that between the retrieval and transfer, they'll ask me to redraw it, or they've gotten the Sharpie themselves and started tracing over where I marked the target. We're happy to do that. Anything we can to make it easy for you to give.
No, perfect. I always tell my patients I'm going to tattoo them with a Sharpie and draw those. But it really does help. With that, is there any tips or tricks you could give patients to help with possibly the pain of the injection, since it is an intramuscular injection, while other injections are typically subcutaneously?
Great question. I think that when you take any kind of injection, it's really not the injection, the needle itself that hurts, it's the medication. So I would recommend that this medication be kept at room temperature. In fact, if right before you give it, if you put the vial in your hand and just kind of do like this, just to warm it up a little bit, that may help. I tell patients to stand up when they do the injection. And if you're going to do it on the right side, lift up that right leg a little bit, and that'll help to relax those muscle fibers a little bit instead of having them tense down. If you're standing on it, if you just have them lift their leg up a little bit, it'll relax those muscle fibers just a little bit and make it a little bit easier. I think after you do the first injection, you're going to be amazed how easy it is. Now, some patients, no matter what, they're terrified about doing it, and they will do anything to get it over with or to increase the likelihood that they're not going to feel anything. There are some patches called Sanera patches that they are by prescription, so you can talk to your provider about that. And it looks like a big Band-Aid that you put right over the site where you're going to inject about 20 or 30 minutes before you do your injection. And that warms and numbs the injection site. Some patients swear by that. And I think they're great too. They are about $10 a piece, so finances can be a concern. If your insurance covers it, it's a no-brainer. If not, think about, okay, that's a Starbucks and a muffin in the morning. Had I rather have the Sanera patch instead? You might want to ask your provider to write for it, try it with and without, and see what you're most comfortable with. I think if you take your weight off the leg, the side that you're going to give it, make sure the medicine is not cold, and maybe put a heating pad on your hip just for a few minutes, just to warm up the skin. I think that's going to be perfectly fine. But the Sanera patches are a great option as well.
No, I totally agree. The Sanera patches I've heard wonders about, and patients seem to love them, but they are a little bit pricier. So I'll tell patients, if you don't want to pay for them, that the injection is, I think most patients are more fearful of the injection before even doing it. And once they do once, they're good. Looks like the last question, I see someone that wrote in, they said after their injection, they're getting these knots or like bumps, probably from the oil, but is that normal? What should they do to help with that? Because it's causing some discomfort when they're sitting down or trying to lay down.
Right. So the most common reason I see some lumps or bumps or redness is when the injections are given too low on the hip, or when the needle doesn't go in all the way. I have had some patients' husbands say, I love my wife more than anybody else. I'm not going to put this 1.5 inch needle all the way under her hip. I'm just going to put it part way or halfway. And that means they're injecting the needle and the medicine into fat. And it's harder for the fat to absorb and resorb the oil. So I would recommend, if you have that happen, talk to your provider, your nurse again, and say, will you show me exactly where to do it? Because that's not a common thing if you're given the injection correctly. So if you are giving it at the right place, make sure that the needle is going in all the way. And you might want to try putting heat on the site before and after, just to encourage that oil to disperse a little bit more.
No, that's great. I always tell patients too, sometimes after the injection, if they do it in the morning or at night, it helps to take a warm like shower to
Oh,
kind of
yeah,
let that water hit, because it'll kind of help again disperse that a little bit better. But great tips.
absolutely.
I don't see any other questions. Do you have anything else you want to um, touch base with? If that medication or any other ones that we talked about as well before we kind of close out?
I think probably the only thing is going to be about progesterone again. Um, just about every patient I see, probably every patient I see, will not want to take progesterone, and they know that they're going to take it and they need to take it and they have to take it. They still dread it. But just about every patient I see too, when it's time to stop it, they don't want to stop it either, because they know that that's helping to sustain a pregnancy. It is helping to stabilize the lining of their uterus. And once they're pregnant, and they're taking the progesterone, they feel a little bit intimidated about stopping taking it. So I have just as much trouble talking patients into stopping as I do coaching them through the process of taking the injection to start with. I think as you go through your fertility journey and you take these different kinds of medications, rely on the support of your healthcare providers, your entire healthcare team, the folks at Mandel's, and always remember that no question is a stupid question except the one that goes unasked. We are always happy to answer your questions and to make sure that you feel comfortable and you completely understand what medicines you're taking, how to take them, and why you're taking them. And we're always here for you should you have any questions, or if you think you might be having a concern or an issue with any of these particular medicines.
Okay, well, Karen, I just want to thank you again. You are a plethora of knowledge and expertise, so thank you for your
Thank you.
time and your efforts to put this video together. And then I want to thank everyone, of course, who joined us via Facebook Live or Zoom. And just want to remind everyone that all of these videos from tonight, along with other virtual experience videos and any on-demand videos, are available on YouTube, on the Mandel's Clinical Pharmacy website, or even also on the Facebook, Mandel's Facebook screen. So you can watch any of those. If you have any questions, please let us know. And then just like a reminder, these videos are taking place every Monday at 7 p.m. Eastern Standard Time. So please join us for the next videos. Invite your friends, anyone going through this, please share. And we can't wait to see you next week. Thanks again, Karen.
Thank you. And thanks to all of y'all. Be well and good luck.